Assalamu alaikum. I am Dr. Selima Sultana, Professor and Head, Department of Pharmacology at Women's Medical College. Today I will discuss about anti-epileptic drugs. So, epilepsy affects 5 to 10 per thousand population, general population. The term epilepsy is used to define a group of neurological disorders, all of which exhibit periodic seizures. It is due to sudden excessive depolarization of some or all cerebral neurons. And depolarization may remain localized, that is called focal seizure, or may spread to cause a secondarily generalized seizure, or affect all cortical neurons simultaneously, which is called primary generalized seizure. What is epilepsy? It is a heterogeneous symptom complex, a chronic disorder characterized by recurrent seizure. And now what is seizure? Seizure is finite episodes of brain dysfunction resulting from abnormal discharge of cerebral neurons. It may or may not associate with convulsion and consciousness. What are the criteria of epilepsy? It is chronic disorder, familial disorder, episodic nature of the attacks, paroxysmal attacks of each episode, and electroencephalogram changes. Now, what are the causes or etiology of epilepsy? Number 1 is primary or idiopathic, which is 75%, and number 2 is secondary causes, which is only 25%. And secondary causes are infection, brain tumors, stroke following neurosurgery, head injury, birth injury, or trauma. Now, the classification of epilepsy. Epilepsy are partial seizure and generalized seizure, and partial seizure secondarily generalized. Partial seizure is excess neuronal discharge, occurs in a restricted area of brain. They are simple, complex, and partial seizure secondarily generalized. Generalized seizure or excess neuronal discharge occurs in wide area of brain. Now, the generalized seizures are tonic-clonic or grand mal epilepsy, absence or petit mal epilepsy, myotonic or atonic, myoclonic and clonic, and infantile spasm. Now, the pathogenesis of epilepsy. Development of epileptic focus in the brain due to deficiency of GABA activity, excess NMD activity in neurons, hyper-irritability of the neuron, spreading of impulse. What is NMDA? Is neuromediator dopaminergic activity. Now, the monitoring is blood concentration of the drug, electroencephalogram, liver function test. Advice to the patient is avoid tension, excessive stress, gathering, physical trouble, and accompanying an identity card. Now, the anti-epileptic drugs, sometimes known as anticonvulsant drug, are used to treat epilepsy as well as non-epileptic convulsive disorder. Anti-epileptic drugs aim to inhibit the abnormal neuronal discharge rather than to correct the underlying cause. Epilepsy was treated with bromide in 1857 and phenobarbital was introduced in 1912 to control patients resistant to bromides. The next significant advance came in 1938 with phenytoin, which is hydantoin derivatives, which structure resembles to barbiturate. And subsequent discoveries produced many other anticonvulsants, but phenytoin remains a drug of choice. Now, classification of anti-epileptic drugs according to chemical nature. Number 1 is hydantoin derivatives, which is phenytoin. Number 2 is barbiturates, that is phenobarbital. Number 3 is immunostimulants, that is carbamazepine. Number 4 is benzodiazepines, that is clonazepam, diazepam. Number 5 is valproic acid derivatives, that is sodium valproate. Number 5 is 6 is succinimide derivatives, that is ethosuximide. 7 is newer drugs, that is lamotrigine, gabapentin, vigabatrin, topiramate, etc. Now, the classification of anti-epilepsy drug according to their clinical use. Number A is generalized seizure, that is primary generalized tonic-clonic or grand mal epilepsy. The drug of choice is lamotrigine, sodium valproate. And alternative are phenytoin, carbamazepine, clonazepam, and topiramate. Absence or petit mal epilepsy, drug of choice is sodium valproate, ethosuximide. Alternative is lamotrigine and clonazepam. Now the myotonic and atonic seizures, sodium valproate, lamotrigine and clonazepam. In myoclonic, there is drug of choice is sodium valproate, clonazepam, alternative is lamotrigine. Now the partial seizure or secondary generalized seizure, the drug of choice is sodium valproate and carbamazepine, alternative is phenytoin, lamotrigine, gabapentin and topiramate. Drugs for partial and generalized tonic-clonic seizures are phenytoin, carbamazepine, sodium valproate, and barbiturate. Others lamotrigine, gabapentin, pregabalin, and topiramate. Absence of petit mal seizure, the drug of choice is ethosuximide, sodium valproate, lamotrigine, topiramate, and clonazepam. Now the principles of management. Any causative factor must be treated, that is cerebral neoplasm. Educate the patient about the disease, duration of treatment and need for compliance. Avoid precipitating factors such as alcohol, sleep deprivation, emotional stress. Anticipate natural variation, that is fits, may occur particularly around periods in women, that is called catamenial epilepsy. Give anti-epilepsy drug only if seizure type and frequency require it, that is more than 1 fit every 6 to 12 months. General guideline to anti-epilepsy drugs. Therapy should start with a single, well-tried and safe drug. The majority of patients, 70%, can be controlled on one drug, that is called monotherapy. Anticonvulsant drug treatment should be appropriate to the type of seizure disorder. Example, carbamazepine is a drug of choice for focal and secondary generalized epilepsy but aggravates myoclonic and absence seizure. Sodium valproate and lamotrigine have a wide spectrum of action and active against both primary and secondary generalized epilepsy. Age and sex also determine the choice of drug. This is particularly true for women. For teratogenesis, sodium valproate and adverse effect on their appearance, that is hirsutism, from phenytoin. If control of a patient's epilepsy with a single drug is unsuccessful, it should be replaced by a second line drug, although these are effective in only about 10% of cases. There is little evidence that 3 drugs are better than 2. More drugs give more adverse effects. Now the abrupt withdrawal. Effective therapy must never be stopped suddenly, either by the doctor due to carelessness or by the patient due to carelessness or ignorance or illness, for status epilepticus may occur. But if rapid withdrawal is required by the occurrence of toxicity, a substantial dose of another anti-epilepsy drug should be given at once. 3 main mechanisms of action appear to be important for anti-epileptic drugs. Number 1 is enhancement of GABA action. Number 2 is inhibition of sodium channel function. Number 3 is inhibition of calcium channel function. Now the anti-epileptic drug phenytoin. Phenytoin is the oldest non-sedative anti-seizure drug introduced in 1938. It is structurally resembled to barbiturates. Pharmacokinetics, its route of administration is oral or parenteral IV. Plasma protein binding 90%. So dose increments should be smaller and less frequent because small changes in binding will result in a higher concentration of free active drug. Therapeutic or low dose follow first order kinetics and high dose follow zero order kinetics. Plasma half-life is 12 to 36 hours. Phenytoin causes hepatic enzyme induction. Due to induction of hepatic enzymes that metabolizes it as well as other drugs and dietary and endogenous substances including vitamin D and folate. What are the indications of phenytoin? The indications are all types of partial seizure, generalized tonic-clonic seizures, status epilepticus and cardiac arrhythmia. Now the contraindications of phenytoin are pregnancy, hepatitis, history of hypersensitivity to phenytoin, febrile convulsion, drug interaction. Now the pharmacodynamics of phenytoin. Mechanism of action is block voltage dependent sodium channels in the normal neuronal membrane, that is membrane stabilizing effect, no neuronal firing and anti-epileptic effect is. Inhibit calcium influx, no release of neurotransmitter of excitation, that is aspartate glutamate, and anti-epileptic effect occur. Now the adverse effects of phenytoin is gum hyperplasia, megaloblastic anemia, osteomalacia, hirsutism, nystagmus, ataxia, diplopia, impairment of cognitive function. Now the causes of adverse effects of phenytoin. Number 1 is gum hyperplasia due to inhibition of collagen catabolism. Number 2 is megaloblastic anemia due to increased folate metabolism. There is folate deficiency. Number 3 is osteomalacia due to increased metabolism of vitamin D and inhibition of intestinal absorption of calcium ion. There is vitamin D deficiency. Number 4 is hirsutism due to increased androgen secretion. Phenytoin is a potent inducer of hepatic enzymes, so it causes metabolism of other drugs. That is, phenytoin plus oral contraceptive pill causes contraceptive failure. Phenytoin plus warfarin causes blood coagulation. Phenytoin plus vitamin D causes osteomalacia. Now, carbamazepine is a tricyclic compound chemically derived from and closely related to antidepressant drug imipramine. It is one of the most widely used anti-epileptic drug. Pharmacologically and clinically, its actions resemble those of phenytoin. The pharmacokinetics of carbamazepine is absorption is slowly absorbed but well absorbed after oral administration. Its plasma half-life is about 30 hours when it is given as a single dose, but is a strong inducer of hepatic enzymes, and the plasma half-life shortens to about 15 hours when it is given repeatedly. Some of its metabolites have anti-epileptic properties. Now the mechanism of action of carbamazepine: it blocks sodium channel, it inhibits discharge of excitatory neurotransmitter from presynaptic membrane, potentiate the postsynaptic action of GABA. Now the indications of carbamazepine are: number 1 is partial seizure, psychomotor epilepsy, secondary generalized seizure, trigeminal neuralgia, bipolar depression, neuropathic pain, manic depressive illness, that is mania. Now the adverse effects of carbamazepine is diplopia, ataxia, blurring of vision, dizziness, hyponatremia due to water retention, GIT upset, bone marrow depression, neutropenia, hypersensitivity reaction. Drug interaction: it is a powerful inducer of hepatic enzymes and causes metabolism of phenytoin, OCP, warfarin, and steroids. Now, the drug is sodium valproate, is chemically unrelated to any other class of anti-epileptic drugs. It is effective in many kinds of epilepsy, particularly useful in certain types of infantile epilepsy. It does not induce enzyme. Extremely metabolized in the liver. Half-life is 13 hours, 90% bound to plasma protein. Now, the indications of sodium valproate are generalized and partial epilepsy, absence seizure, prophylaxis of febrile convulsions, post-traumatic epilepsy, migraine prophylaxis, and bipolar disorder. Now the drug is sodium valproate. Its mechanism of action is inhibits GABA transaminase enzyme responsible for the breakdown of GABA, the inhibitory neurotransmitter. So decreased breakdown of GABA, so there is increased concentration of GABA in the brain. But now the adverse effects of sodium valproate are GIT upset and heartburn, weight gain, teratogenicity, polycystic ovary syndrome, loss of hair, that is alopecia, pancreatitis, transient rise in liver enzymes, hepatotoxicity, and coagulation disorder. Gabapentin, this is another drug, another anti-epileptic drug. It is an analog of GABA, more lipid soluble and crosses the blood-brain barrier. Mechanism of action is by blocking calcium channel, reducing the release of various neurotransmitters and modulators. Does not induce or inhibit hepatic enzymes. Now the indications of gabapentin are partial seizure, secondary generalized seizure, neuropathic pain, and adverse effects of somnolence, dizziness, unsteadiness, and fatigue. The next drug is lamotrigine. It is a broad spectrum anti-epileptic drug. Its mechanism of action is acts by blocking voltage-dependent sodium channel and stabilize presynaptic neuronal membrane. Thus reduces the release of excitatory neurotransmitter such as aspartate and glutamate. Now the indications of lamotrigine are partial seizure, absence seizure, primary and secondary generalized seizure, that is tonic-clonic seizure. Adverse effects of lamotrigine are nausea, dizziness and ataxia, hypersensitivity reactions, Stevens-Johnson syndrome, toxic epidermal necrolysis. Now the drug is ethosuximide. It is succinimide derivatives, differs from other anti-epileptic drugs in that it blocks a particular type of calcium channel that is active in absence seizure, that is petit mal epilepsy, and it is used specially for this condition. Adverse effects of ethosuximide are GIT upset, CNS effects, allergic reactions, eosinophilia and other blood disorders, and lupus erythematosus. Now another anti-epileptic drug is topiramate. Its half-life is 21 hours, allows once daily dosing. It is excreted in the urine mainly as unchanged drug. Mechanism of action is block the voltage-sensitive sodium channel, enhancement of GABA activity, block glutamate receptors weakly. Indications of topiramate are as an adjunctive treatment for partial seizures with or without secondary generalized. Adverse effects of topiramate are sedation, weight loss, acute myopia, raised intraocular pressure, teratogenicity. Now the drug is vigabatrin. It is structurally related to GABA. Mechanism of action is irreversibly inhibit GABA transaminase enzyme so that GABA accumulates. It is not metabolized. It does not induce hepatic enzymes. Indications of vigabatrin is in partial and secondary generalized seizures which are not satisfactorily controlled by other anticonvulsants, infantile spasms as monotherapy. Adverse effects of vigabatrin are visual field constrictions, confusion, psychosis, weight gain. Now the condition is status epilepticus. It is a medical emergency. It has 3 stages: early status, established status, and refractory status. In early status, lorazepam, clonazepam, diazepam IV are used. In established status, phenytoin and phenobarbital are used. In refractory status, thiopental sodium or propofol or midazolam in full ICU support. Doses and administration of anti-epileptic drugs. Generally, drugs are best given as a single or twice daily dose to increase compliance. In general, drugs should be started with a small dose and increased at 2 weekly 14 days intervals to the minimum effective dose. The patient's seizures are then monitored and further increases in dose only made if seizures continue, and monitoring of blood concentration. Now the drug withdrawal. After a period of at least 2 to 3 years free from seizures, withdrawal of anti-epileptic drug therapy can be considered. It is generally recommended that anti-epilepsy drug be withdrawn over a period of 6 months. If a fit occurs during this time, full therapy must be resumed again until the patient has been free from seizures for a further 2 to 3 years. Now the drugs used in absence seizures or petit mal epilepsy are sodium valproate, ethosuximide, lamotrigine, topiramate, and clonazepam. Pregnancy can affect seizure disorder, which worsen in about 1/3, improves in about 1/3, and unchanged in the remainder. Now the teratogenic effects of anti-epileptic drugs. Anticonvulsant embryopathy, which comprises major malformations, often cardiac, microcephaly, growth retardation, hypoplasia of the midface and fingers. The frequency of malformations increase in phenytoin alone or phenobarbital alone. Folic acid taken daily prior to conception and through the first trimester reduces teratogenic effects. Carbamazepine is the safest drug during pregnancy. In pregnancy, carbamazepine is the safest drug, and lamotrigine, phenytoin causes fetal hydantoin syndrome. Anti-epileptic drugs and breastfeeding. Phenytoin, sodium valproate can be used during breastfeeding because they less pass into the breast milk. Absolute contraindications are phenobarbital, primidone, and ethosuximide. Epilepsy and oral contraceptive pill. Lamotrigine and sodium valproate can be given as they are not enzyme inducer. Febrile convulsion in children, diazepam suppository is given. Infantile spasm, corticotropin, IM, prednisone, benzodiazepine, clonazepam or nitrazepam, and vigabatrin. These all are about anti-epileptic drugs. Allah Hafiz.